Hi, welcome to Advancing Our Foundations, Healthy Thoughts for a Good Life, a new outreach series leveraging the power of podcasting, video, and social media to educate professionals and anyone in family life about psychoanalysis and psychodynamic thinking. Here's Dr. Margarita Gurry.
Welcome to Advancing Our Foundations, Healthy Thoughts for a Good Life. This is the Florida Psychoanalytic Center's first podcast as outreach, sharing all of the information that would help any of us understand better psychoanalytic thinking and about psychoanalytic theory and practice. It is based on lots of research and based on lots of experience. And who better to kick this series off than Dr. Peggy Hutson. Dr. Hutson is one of my personal favorite grown-ups in all the world. She is a longtime training and supervising analyst for the Florida Psychoanalytic Center. She is still active on the foundation and in teaching at the University of Miami. She is a well-known expert in issues with self-esteem and shame, unconscious gender messages and envy, and the gift that keeps on giving, fear of success. Dr. Hutson, thank you for joining us. What is psychoanalysis and psychodynamic thinking? How does it help us? And help us understand about the work of the foundation and the center. Thank you, Dr. Hutson.
Okay, psychoanalysis is a type of understanding and then therapy for the mind that involves all the development and how it fits into the way we become. Much of it is conscious, but unfortunately, much of it is unconscious, particularly the first years of life. And if something is put into one's dictionary of life in one's mind and you don't even know it's there, you may not be able to differ. You may have poor self-esteem, things like that. If it's been put in well and you've had a fairly maturing life after that, then you will be able to navigate through life pretty well. And you can always get help with people who deal with dynamics, the psychodynamics.
So if I didn't choose my parents well, I'm not doomed. Is that what you're saying?
That's exactly what I'm saying.
Well,
and
good.
You know what? You say choose your parents well. I think most parents do the best they can do.
They do, I believe. And
also, the training for parents, it was about how to feed children. Think about it for years and years and years. It's just now that many people have gotten involved in trying to help parents, how they can help the children with that first understanding of life by the way they treat them.
Certainly throughout time, our view of childhood has changed.
Yes,
it's amazing. So what is the sweet spot? If we're having parents out there who really want to be even better, even though they're already good parents, what are the critical time periods that they can really think, I made it past this one? What are those?
Well, the first 5-6 years of life, or 4 or 5 years of life, are really critical, and they are perhaps the most difficult. But in taking care of your child, you are making a lot of understandings go unbeknownst to them into their mind. For example, if you don't want to hold your child long enough when they're little, and you just throw them back in the crib like some people do, the child will feel, a terrible separation anxiety from that early part of life. And that's what makes panic attacks later on, and separation anxieties. And it can be treated. You can go back and with the psychoanalytic approach or psychodynamic approach in working with the patient, they can pick this up and they can use their adult mind to deal with that earlier stuff put into them once they understand it.
So if I'm a parent and I want to be able to do better for my children, is it better to put my child in treatment or myself in treatment?
That's a good question. If you're still taking care of the child, you should both be in treatment. But let the person who does the evaluation decide.
Okay, good. And so how does everyone find that good fit of a therapist for them or for their child? How do you know it's a good fit and how do you find it?
Well, you can go through an evaluation with the person and see how well it fits.
Okay.
Both the analyst or the psychodynamic therapist, that person has to feel comfortable working with the individual, and the patient has to feel comfortable. And like with the children, sometimes it's a fit and sometimes it's not. And therapists are taught not to take that personally, you know.
No, it's not personal at all. It's
No,
just
it isn't really.
No, it isn't.
You know.
So if I'm an adult now and I have had good parents, but there's some issues that I'm struggling with. Maybe
Yes.
I picked the wrong partners. Maybe I'm anxious. Maybe I sabotage myself all the time.
Yes.
Help me understand, what do I need to do now? I can't go back and be a baby again. So how do I fix that in terms of thinking?
Well, going back and getting the information from before is not being a baby again. It's finding out what's holding us back. It's like developing the conscious mind so that it can be introspective.
Okay.
We usually don't think about our thinking. But if you can think about it and pick up things with the help of the analyst, then you can change them. Like, for example, if anger was taught to be equal to loss and aggression, you may have been unable, for example, if you were married to the wrong partner, you may have been unable to talk things out with them and see. I mean, even when we date people, that's, you know, first of all, we feel romantic at first, but then we should do a very careful evaluation, and so should the other person, to see if it's a fit.
All right. And how
talk things out.
What are the questions we need to ask to see about that fit?
You mean ask the partner?
Ask a partner, or even ask ourselves. I mean, how do...
Well, things you have to ask yourself is, how well do we talk out our differences?
All right.
You know, are there gender messages like the male runs the show all the time, or the female runs the show? There aren't too many of those, but you see?
Yes. All right. And so...
so you try to look for those things. If you came from a place where the man and woman are equal, and you're with a man from a chauvinistic environment, that will be in his database, and he won't even know it. He'll just assume it. So you see, what does it fit? Do you see?
I think that makes a lot of sense.
The other thing you have to evaluate in people is their self-esteem. Do they always have to have the last say? That's one of the biggest problems people have, self-esteem. And you want me to tell you what makes that?
Yes, please.
Okay, what makes that are two things. One are the labels given to ourselves, like if somebody says you're so ugly, that will go into your understanding of yourself as a human being. And you won't even know it, you'll just feel that way. Or if they called you stupid all the time as a little child, you'd walk around thinking you're stupid, and you would think everybody else thought you were stupid. But if they said you were such a sweet, nice person, or you're such a handsome little boy, that would be in your database, definition of the self. Now, the other thing that goes in making ideals would be if the kids are always taught they have to be perfect, the ideal will be for perfection, and that is not good. That's why people sometimes kill themselves when they make a mistake, which is a shame, because they don't even know they have this terrible ideal.
So you're talking about suicide, or you're just talking about being harsh with themselves?
It can be both. I talked about the extreme. I went to the extreme, okay?
All right.
But the ideals, one has to go pretty far along for it to hit the extreme, but they can be like putting yourself down if you never make all A's. Walking along feeling sad no matter what you do, it's not good enough, you know?
Yeah,
or having the ideal. For example, if we go just to genders, if the ideal that you were brought up with in the family, unbeknownst to you and unbeknownst to your parents, it's passed on. If it was the male is the ideal gender, you will have that in you as a girl and as a boy. And you don't even know it.
All right. So we find out by what either helps us or gets in our way as we go along life.
Yes.
I think
And
that's
if you can spot your symptoms, then you can get help for it with somebody who understands the psychodynamics, that approach.
I think that's lovely. So if someone doesn't want to do treatment, can they just do reading or look at videos about psychodynamic thinking and help themselves?
That's pretty hard. They can try, and if they can spot the things, but the problem is that we aren't that introspective thinking about our thinking, and it's hard to pick up the things that are unconscious. The things that are conscious, sometimes you can, sure. That's how we continue to mature for life, isn't it?
Yeah, I think so. You know, the thing that struck me about most of the analysts that I have met
yes.
in my many years of life is how kind they are, mostly. And I think that it's nice to have a kind partner in looking at ourselves, because we're also wonderful and awful, and help us get to a place where we are more self-aware and don't stop ourselves. You know, I've just been very touched by the kindness of the analysts in the Florida Psychoanalytic Center and also the Baltimore, Washington as well. I've been very touched by that.
Well, I think they had a lot of help because they were required to have an analysis too. So they could be objective and kind, as you say. Yes.
I think that's wonderful. So what do you think that the professionals out there in our community need to know about the resources at the center? I mean, how can the center help them professionally and personally?
They can give them the names of therapists. We are hoping through the foundation to have a lot of outreach, a lot more. We used to before, and then we changed to a center, and now we need to get the foundation and the center up and running again with outreach and with programs for people.
Right. I understand that you've had a huge graduating class for analysts. Congratulations, certainly, with the reorganization from an institute to a center. You guys have been really on point. I'm super excited about the idea of the outreach. You also have, so to become an analyst, let's say there's a professional who wants to be a better professional, but also better self. Please help us understand psychoanalysis and the program, and also the psychodynamic program.
You mean how it trains people?
Yes, and what's the difference and all? Help educate on that, please.
Okay, in general psychiatry, you particularly are good with cognitive approaches. We try at the med schools, and I'm sure in the Department of Psychology, to do some dynamics. But what the the center does is it has two programs to further train people. It has the psychoanalytic training program, which means you go in for about 5 years. You take all kinds of further classes from the research that's been done over the many, many years. And you also have your own analysis, which means that you pick up whatever you're missing on. And then you have supervised cases. So you learn how from people who have gone through a lot of training, you learn how to do the psychoanalysis. Now, we also have a psychodynamic psychotherapy course. It's a 2-year course. A lot of people from the med school are invited to be in it, and from the community. And we have a large PPC, it's called. And this is a 2-year program that teaches about psychodynamics. It suggests psychotherapy or analysis for people, but it's up to, but it is recommended, so they know more about themselves. But it also focuses very heavily on getting the information, the further research in. For example, the new research from England about early development. We now know even when the mind develops to the point of knowing the difference between self and object, we know that the sexual drive doesn't begin at adolescence. It begins at 2 years and 6 months. This came from all the child research. And it's very interesting.
I think it's wonderful how research-based some of these thoughts are.
Yes, absolutely.
And what does PPC stand for?
Psychodynamic Psychotherapy Course.
And what do you call the psychoanalytic 5-year program? What do you call that?
It's called the psychoanalytic, we used to call it the the Psychoanalytic Institute training. We've changed it from an institute to an education committee meeting. So it's just the psychodynamic, it's the Psychoanalytic training program under the Florida Psychoanalytic Center.
All right, that's lovely. So that's for professionals. And
that's for professionals, and they can be psychologists, psychiatrists, social workers, and they've occasionally had some nurses they trained.
Psychiatric nurses.
Yes,
right.
Exactly.
All right, that's wonderful. I mean, I think it's very nice to have all that. And so how about for the families? Let's say they want to get more educated. What outreach for education would you like to see the center doing, supported by the foundation?
Okay, what I'd like to see is the outreach is looking for some of the major problems for families and so forth, is to have seminars here and there. They can be ones that have several meetings, or it can be a lecture where there's discussion afterwards. We're just regrouping now and going to do outreach again. We used to do it before. Like, we sent workers into the school systems around Dade County, public and private, to do help with the parents, to help educate them about this early developmental material.
Great.
We did that for a short time, but that didn't work out because the parents weren't coming to the PTA the meetings. It was really interesting. We've tried various things.
Okay.
We had group meetings. We would cover a particular subject, and we're going to do that again. So if anybody in the public thinks of a particular area that needs help in, I mean, we're thinking about it, but if they think about it, they should call the center and let us know.
All right. And so do you offhand know the phone number for the center? If not,
I don't offhand know it. I'm sorry.
You know what? That's okay. I don't know it either. I'll put it on the bottom.
Okay,
banner.
if you could.
Okay. We'll do that with the email so that anyone can reach out. I would love for anybody to let the center know what they're interested in learning. What are the specific challenges for an individual, whether they're young or old, it doesn't matter. I'd love to know the requests and the concerns.
That would be a nice thing, because then we could make courses.
Yes.
Like, we could offer 3 or 4 lectures on it. We can take about 25, 30, 35 people in our education room.
I love that. I love the idea too of videotaping that so that it can be accessible to anybody. And I love the idea of all of the different members who are so learned to be able to make blogs, articles, white papers, little videos, and podcasts such as yourself. You're our first live podcast. Dun, 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 dun. So I think I think we're off on a roll trying to help the center complete its mission in today's times with the technology that is so amazingly easy to use in terms of outreach. So I'm pretty excited about that.
Well, you have a lot of experience, so we're very grateful to you for helping us.
Well, I'm delighted. I think we're all on the same mission. We want everyone to feel great about themselves and to make this world a better place. I think certainly it would help people drive more with more manners, I think, as well. So I'm looking forward to that as I drive from Miami to Fort Lauderdale. It would be nice to have that, wouldn't it? That's a nice byproduct of good thinking and good treatment.
Right.
So in terms of the myths, what are some of the myths that we can bust now about psychoanalysis? I know everyone's heard about Sigmund Freud and his daughter Anna. So what are some of the myths that you can bust that help people understand the amazing richness of psychoanalytic and psychodynamic thinking?
Well, it used to be just limited to what Freud talked about, but it is based on research now, and very well based on that. And so every area that comes up, people get interested in, they write about it, and then they share it through their writings and so forth in classes. And one of the greatest things that has happened has been the research, the early developmental research that began over in England. And it really has helped us understand what happens to us from the beginning of life.
I think that's great. And
your mind is empty at first. Well, unless a dog barked in your house. They did have one example that children brought home from the hospital. If a dog barked before you were born and you heard it through the, it would apparently get through. You wouldn't be alarmed. But if you were brought home to a house where you never had a dog before and it had a dog and it barked, you would have an alarm reaction.
well,
Other than
that's
that,
cool.
there's not too much in the mind.
How about if you hear parents fighting in a very aggressive manner? When you come home, how does that affect that baby?
Well, there's lack of safety and security. It picks up the anxiety.
Okay.
And people who are fighting and parents who have not learned to talk it out, sit down and talk things out and be comfortable with anger in terms of how to use it, then the child gets anxious about it. Because your safety and security for the child is based on the parents there,
Yeah. I think anger is an amazing gift if we learn to use it effectively.
That's why I teach, and this is another thing we want to do. We want to teach parents how to train the children about talking it out. Nobody ever taught us that before. But it is telling the child to, listen, you're screaming and shouting right now. Just go in your room, settle down. When you're done, come on out. We'll talk about it because you could be right. I could be right. We could compromise and agree to disagree. And it takes a lot of time to do that with a little child.
Sounds like a worthwhile task.
When you grow up, then you see that anger is critical thinking, which comes under anger, is crucial for saving ourselves, for working things out in the world. Think of the people who are very masochistic. That means they can't attack, they can't stop things. They can't criticize. They can't protect themselves. They can never say no. And that's sad. Or
That is sad.
They say it in a very aggressive way because they haven't gotten this other early training. Let's sit down and talk it out.
That is very sad. So if someone's masochistic, how do they fix that?
Well, they don't know why they're that way. And it's from before the age of 6 or 5, usually. And they have to go into a psychodynamic psychotherapy or psychoanalysis so that they can think about their thinking. And eventually, with the training of the analyst, they begin to make connections. Like they make a team with the analyst. Their mind thinking about their thinking along with the analyst. And they go back and forth, and you find answers through dreams, through all kinds of things. And it finally comes forth. And at the end, you should be able to set limits.
So how does noticing something help us change it?
Well, if you find out that you were abandoned because you differed, if that turns out to be the thing you're always expecting, which is picked up, if the analyst is well trained, they'll look at the associations and follow the principle of how to do that. And if that was from then, and your upper mind, your adult mind realizes that, then you begin slowly to differ. Even with the analyst, it's a good thing.
It's a very good thing.
Anybody.
Oh, I think that's lovely. So you've given us a lot to think about. The whole idea then of moving forward, what would be the ultimate goal of any treatment, whether it's psychoanalysis or a psychodynamic therapy? What's the ultimate goal?
The ultimate goal is to get rid of the conflicts so that the person is able to, one, appreciate themselves, well, one, be able to differ, two, be able to appreciate themselves and not beat themselves up when they're not perfect. That's about good self-esteem, and you have to work it out by dealing with the superego and the definitions given to the self, and then sexually if they have any problems there. When Freud began his writing, it was heavily about sexuality, but they didn't know about the early development. And he left the door open for further research. And people can have sexual problems.
So how do the sexual problems start in childhood? You said it was before age 2 years, 6 months. How does that get started?
The way it gets started, for example, is when the drive starts at 2 years and 6 months, someplace along the line early, and the children begin to peak and everybody knows they had peakers. And this is all before 4 or 5, okay? And then they began to exhibit, run down the hall naked without their clothes. And we had to teach them.
They do.
Okay, well, that's exhibiting. And they began to touch themselves as the drive began. And some parents say, you do that again, and I'm going to cut your leg off, or I'm going to cut your penis off. No, there have been really weird reactions before to it. And now we're trying to help them say, you know, that's a normal feeling and so forth, but you do it in your private room or when you're in the bathroom. So the child learns where that is to be limited. But if it's been mislabeled, and it often was, it can cause an inhibition sexually.
That's interesting.
Even the ideal that girls are less sexual than boys was an old idea.
Who started that rumor?
I don't know, but it surely was there a long time ago. And you have to look at the different cultures. That's another thing. You have to study the different cultures about what the passed on things were in each culture.
Well, that's so true. Well, that's exciting. Just the idea that anybody has the ability to go back and learn from their past to fix their present and future. I think that's very exciting.
Right. If they find the right therapist, they connect well, yes.
So is anyone ever really done with therapy? That's one of the myths, that once you start. Yes?
You want to be sure that the therapist should be sure that try to be sure that those conflicts that I talked about are taken care of, but then maturity goes on for a lifetime.
Good. Well, why do some people seem to stop growing at a certain age, whether it's in their 20s or 30s or 40s or 50s? Why do some people just kind of stop maturing?
They often stop because of these conflicts. They have to stay the same. They're very limiting. It's like the early input controls you. Like the people who can't be angry, can't say no. They'll do that at 20, 30, 40. Or the women who feel second rate because they're female. Unless you get to that, that's found in a lot of the anorexics today. And it's so sad, you know? It can be taken care of, yes.
It is sad.
And this is why my last goal in life would be to outreach about child development and pass this on.
Well, let's do that.
Yes.
I'm going to make a call to action. Anyone who's out there listening, send us your articles, links to videos or white papers or blogs or anything that might help educate professionals and anyone in family life to have healthier thinking for a better life. Looking forward to helping you and the center achieve those goals with the help of the foundation. That would be wonderful, I think. So, any last questions or statements that that you think we need to make?
I think we've covered the bases pretty well.
I think we have to, and I thank you so much for agreeing.
This is a good beginning, okay?
It is. It's a good beginning, and I'm super excited. And I know that the world can be a happier and better place, certainly more civil. And we need everyone to be at their full potential because we have an interesting future ahead of us, all of us.
Yes, yes, absolutely.
We absolutely do. And I have faith we can do this if we all pull together and share information and think about thinking and allow change to happen in all our lives. So I'm excited about that. Well, thank you, Dr. Peggy Hutson. I'm excited.
Thank you.
And you take care, and we will look forward to seeing what the center has to offer.
Okay, thank you.
Thank you. Bye-bye.